Minnesota Help Me Grow. When parents know, children grow. Age 2 months. By 2 months of age, most babies are smiling, a wonderful reward. Cognitive development. Although your baby won't understand the words you're saying, your baby needs practice hearing the words. Talk to your baby about what you are doing together. Your baby's eyes can now follow moving objects, a skill called tracking. Get your baby to look at your face or bright objects and move slowly in one direction and let him follow it. Suspend toys just within his reach. He will look at toys and at some point bat at the toys, which helps him develop his eye-hand coordination. Social and emotional development. When her eyes are bright and alert, she is saying it is time to play and interact. If she fusses, cries, or arches her back, she may be telling you she is getting overwhelmed and needs comfort or a break. When your baby cries, try to understand what your baby needs. Soothing her makes her feel safe, secure, and loved. She may try to bring her hands up to her mouth. Don't discourage her. It is a special way babies try to soothe themselves, like they did in the womb. If you become overwhelmed or begin to feel angry with your baby, ask for help or find a way to take a break. You may need to put your baby down in a safe place and step away for a short time. Never hit or shake a baby. Large and small muscle development. Let your baby experience different positions throughout the day, on his tummy, back, or sitting on your lap. This helps your baby develop strength and muscle coordination. Giving your baby plenty of tummy time is very important to helping your baby develop strong muscles. By 2 months of age, a baby should be able to lift her head slightly and turn her head from side to side. Try placing a small blanket roll under his chest, which helps him to lift his head a little more easily. Remember, babies should sleep on their backs to lessen the risk of sudden infant death syndrome, or SIDS. At 2 months, a baby still has the grasping reflex, meaning he can hold on, but he can't let go easily. Over the next weeks, you'll notice his hands become open more often as his grasp reflex lessens. You can place small rattles or toys in his hand for him to feel. Language and communication development. 2-month-old babies are beginning to carry on conversations. Watch how this 2-month-old baby carries on a cooing conversation with his father. When your baby smiles and you smile back, two-way communication has begun. 2-month-olds also communicate by crying or fussing as a way to signal they are hungry, tired, too stimulated, or want attention. There are a lot of things you can do to help your baby grow and learn. An important way is to give your baby plenty of love and attention. Some ways you can support your child's development are to play with your baby, talk and sing to your baby, always hold your baby when he is eating and make meal times enjoyable, and give your baby lots of time to play on the floor so he develops his muscle strength and control. Sometimes babies aren't developing typically or as expected. There are some signs that may indicate your baby may not be developing as other children his age. If your baby is not having regular times when he is alert and interactive, if your baby never smiles, your baby's body seems too stiff or too floppy, if your baby never turns his head from one side to the other. If you have concerns about your child's development, contact your healthcare provider, or you can call the Minnesota Department of Education Help Me Grow information and referral line at 1-866-693-GROW. For the past 2 months, you've been helping your little one adjust to the world while you adjust to being a parent. There are some things to understand about the feelings you may be experiencing. Many parents experience baby blues, a feeling of being overwhelmed, tired, and a little sad in the weeks following the birth of a baby. Baby blues are very common and usually disappear in a few weeks. You can help yourself by getting as much sleep as possible and eating nutritious foods. Sometimes a new mother or father experiences more intense symptoms that last beyond a few weeks. Postpartum depression is more serious, and every year, more than 1 out of 10 new mothers and fathers suffer from postpartum depression. It can occur up to a year after a baby is born. Some of the symptoms of postpartum depression are feeling restless and irritable, feeling sad or hopeless or overwhelmed, crying frequently, having low energy and little motivation, having trouble focusing, remembering, or making decisions, feeling worthless and guilty, having little or no interest in activities, withdrawing from friends and family, or having headaches, chest pains, or feeling like your heart is racing. Tell your doctor right away if you think you may be suffering from postpartum depression. There are treatments that can help you overcome postpartum depression. It is important to seek treatment, as depression keeps you from being the parent you're capable of being. You, your baby, and family will suffer if the depression is not treated.